against global shocks. With more than 400 million jobs lost already, 1.6 billion of our brothers and sisters in the informal economy facing destitution. We need social protection now.
काम करने से मना कर दिया गया। हम घरों में फिर जाने नहीं जा भी नहीं पाए हमने। नहीं, मेरा तबीयत खराब था, बुखार था, मतलब मैं नहीं जा पाई काम पे। फिर टीका लगवाए, जब जा पाए हमने तो भेदभाव इससे करना पड़ा कि मतलब सरकारी में लेके जाओ। जो बड़ा आदमी रहते थे उनसे अच्छा वो करते थे, बोलते थे, और हमसे तो इतना हम लोग जाते थे तो दवाई भी नहीं देते थे, हमें बेड भी नहीं दिया, प्राइवेट में इलाज भी हो सकता था। तो मैंने क्या तो सुरक्षित व्यवस्था होगा विदर्भ होगा देश विदेश देशर मे भी जो है ना बीमा सुनना जिस कला ले दी थी मेहनत मैं कला गले मैं तो घर घुसनी गले रहना के जगह नहीं मेरी बात पंचायत के जगह गले विदेश में गले भरे देखी थे कागज घर के सुनवानी के बुझवानी पूरे गला अच्छी है हटाना
don't have social protection. I think social protection is important because it will ensure health care and stuff, because it support also provide support for our family in case of emergency.
Really want to talk about the number of deaths that could have been saved because of we need to see that a proportion of this could have been prevented easily with the access of vaccine. But the other part is, it's not just an issue of vaccine. When we see COVID, we have realized that the access to medicine and medical products was important in the whole chain, right from getting yourself tested or the access to reagents in the lab to, the medicines that you are given.
Yet today, we are seeing that vaccine vacuum. Vaccines are reaching high-income countries quickly, while the world's poor have none at all. Science is succeeding. Solidarity is failing.
コバックス自体はできるのは早かったんですよね。ところが一つ問題だったのは先進国はまずコバックスから買わず直接、メーカーと交渉をして、買ったと。で、それもものすごい高値で、買ったということですね。しかも大量にというのが大事。で、結果として大量に買われたので、コバックスに供給する分が製薬企業はなかった。
自力で欧米の製薬企業と交渉を試みる途上国もありましたが、その壁はあまりにも高いものでした。
先進国のメーカーの交渉態度というのは非常に悪いものであったと。なので結局多くの新興国では、先進国のですね、ファイザーやモデルナのワクチンは結局買えず、他のオプションに行かざるを得なかったという。
So then, due to this whole, global inequity to access, South Africa and India proposed this TRIPS waiver, which is basically a mechanism that would ensure that we don't have patents on COVID-19 medical tools for the duration of the pandemic. This was proposed in October 2020.
この提案に対し、アフリカや中南米、アジアなど65カ国が共同提案国となり、100カ国以上が賛同しました。しかし、EU、米国、英国、日本などの先進国は猛反対。議論は完全に膠着状態となりました。2022年6月、WTO 閣僚会合にて2年半にわたる知的財産権の一時免除をめぐる議論は終結しました。反対国は最後まで態度を変えず、妥協の特許の 一時免除の対象となったのはワクチンのみで、治療薬や検査キット、人工呼吸器などは除外されました。
But there was first of all, there was a shortage of oxygen cylinder. So many patients didn't have access to oxygen. And people run out of food, in particularly the poor people.
So in March of 2020, South Africa went into a very difficult lockdown. Thing that happened that was not good is that many people lost their jobs during that first big wave in 2020. About 3 million people lost jobs, but 2/3 of that, this was women that lost jobs. So
One, two, three. 1, 2, 3. Sorry, we're just readjusting the microphone a little bit. 1, 2, 3. Okay. Can you hear that? 1, 2, 3, 4. Okay. 1, 2, 3. Okay. Yes. 1, 2. Yeah. 1, 2. 1, 2. 1, 2. Okay. Test. 1, 2, 3, 4. 1, 2. Sorry. Hi, for those of you who are following online, not you guys in the room, you will be able to watch the videos on YouTube. Sorry that we have bad sound quality while showing the video, and interpretation will carry on as much as possible after the videos. Thank you.
We'll share this.
And the videos, as Pradeep is saying, will be shared in the chat. Thank you.
Thank you so much. Of course, power has only one duty, and that's the duty to secure the social welfare of the people. This is the reason gathered in this room. So I will be introducing our panelists. I want to start with is a Floors, strategic advisor for African Platform for Social Protection and Strategic Partnerships, advisor for Great Rights and Aging, gained over Aid, Amnesty International, Save the Children, currently organizing partner of the Economic Commission of Europe, Regional Civil Society Mechanism, Volunteer Refugee Guide for the Harlem Bamba Foundation for Victims of Human Cruelty, and Rusty of Widows for Peace Through Democracy, supporter of, collaborator of the Action for the floor.
To be here to the panel. Making it together at short notice, it was a really great. Following that, the right to social protection and the call for the Global Fund for Social Protection, which is in our declaration, and how it came about. As we've heard, we all have the right to social security and are obliged through SDG 1, Target 3, protection floors. These were agreed in 2012 by ILO member states through its recommendation 202. I'm part of a coalition of over 100 organizations, open to membership, please join, civil society, faith-based trade unions and think tanks, who came together in 2014 and are calling on governments worldwide to honor their obligations and to ensure that national and global solidarity prevails, that national social protection floors are guaranteed and in place in all countries through sustainable funding made available to all people. We put out our call for the Global Fund for Social Protection, which could be named something else, but it would be in the spirit of solidarity. National floors of social protection are vital to leave no one behind. They ensure universal access to healthcare and basic income security across the life course. They are a human right. It's an essential lever to realize the Sustainable Development Goals and their targets, and underpins the global commitment to end poverty and reduce inequalities for all people within and between countries. However, as we heard, only 47% of the world's population are covered, which means that 53 are not, by at least one social protection benefit. In Africa, this is 18%. As a result of COVID, the war in Ukraine and other conflicts, the number of people facing acute food insecurity has more than doubled from 135 million in 2019 to 276 million in 2022. Multiple studies have shown that ensuring a basic level of social protection for all is affordable for most countries and entirely achievable through the solidarity of the international community. We heard today from Amitabh that about the gross accumulation of wealth of the few. So while many national governments develop and finance and implement their floors with the participation and monitoring of civil society, and generally the financing of social protection falls to national budgets. However, there are some countries that require temporary international co-financing while they strengthen domestic resource mobilization. And the UN Secretary General and the International Labour Conference have expressed their support for the establishment of a mechanism such as a global fund. So what do we want? We want a fund based on the principle of global solidarity to support those countries and their citizens to design, implement, and in specific cases, provide co-financing as described in ILO Recommendation 202. We also want effective participation of social partners representing, something's gone wrong with the sound, lost sound, representing people of all ages, including women, people with disabilities, older persons, minorities, and those living in poverty, in their design, implementation, and monitoring. I'll say that again. Organizations representing people of all ages, women, people with disabilities, older persons, minorities, and those living in poverty. And we want to ensure that they are embedded in national legislation, budgets, and programs to provide for sustainability and reach. These very days, the Human Rights Council is debating a report of the Rapporteur against Extreme Poverty on inequality, social protection, and the right to development. It recommends the establishment of this fund. So we're looking now for international support for this. And we would like you to join forces to make sure the fund is put in place and that we can at least take steps to provide some assurance for the global right to social protection. Thank you very much.
Thank you, Sylvia, for this presentation. Social protection is a human right, and how do we ensure that this right is protected at all levels? So we'll turn to our next speaker, and that's Sin Putri. She's presently the Executive Director, Cooperation Committee for Cambodia, membership-based organization of 200 NGOs. She has worked for civil society sector for over 15 years in the field of advocacy, policy related to democratic space. At the regional level, she's the Global Council member of FORUS, the Global Council of Global Call to Action Against Poverty, and the former steering committee member of Asian Democracy Alliance in 2020 to 2022. Her main role in the platform are to advocate for better policy development at the national and regional paradigm, bring the common voices from the civil society to the policy engagement and discussion, especially on the civic space and digital rights are also her expertise. Sin Putri graduated from Hong Kong master degree in international journalism in 2013 and 2 bachelor degrees in the field of media and communication, and the second one in education in 2006 from Royal University of Phnom Penh. She has been to 12 European countries, the United States, and over 10 Asian countries during her educational training and professional development. You have the floor.
Yes, thank you, Caroline. Good morning. Oh no, maybe good afternoon because it's over 12. Yeah, so I'm glad to be here as part of GCAP Global Assembly and also part of GCAP representative, and we will talk about the vaccination, people vaccination, and as you might know on the screen or the videos, there's many atrocity happened during the COVID, and especially it's about the death toll of the COVID. Officially, it's around 6.95 million people, but the estimate of 17.8 million that not reported, that lost their life. And this is, if we talk about social protection, if we talk about social inequality, of course, you can imagine how the poor country, because we are from the global south, I'm from Cambodia and part of the global south. So we can see the inequality during the COVID pandemic on how to access to the universal declaration or universal care, healthcare. So during the campaign from the GCAP Global, we have together from Asia around 100 civil society we all come together, and those countries, including the Philippines, Nepal, India, Pakistan, Bangladesh, we have advocate for mechanism for free vaccination at that time, because it's very expensive and people cannot access to vaccination because it's very expensive. And throughout years of advocacy, there's still the challenge, as you seen in the video, as the background information, that the high income country, for example, in Asia, we have Japan and Singapore, who until now, the reject of the what we call it's come from the word trade relation, international, intellectual property, intellectual rights, for the intellectual rights for the medical, for this medical, and it's not happen that they're gonna give free vaccination, but after many advocacy, they agree to somehow the vaccination, but the test and other needed, for example, they don't have oxygen, they don't have all the ventilator equipment, they are not provided. So it's still a kind of the very expensive in the mean of universal health declaration, and this is bring the poor country from the global south even vulnerable to the social protection and health coverage. That's what we aiming for. So the action together for this campaign is continued, because country like EU, UK, or US, they already reject it, and I mean they already say no to those free intellectual related to the their property of property right related to their vaccination. So this is very challenging. So we together, just from the low and income country, have made various proposal to the pandemic and equal access through the decentralized product and technology transfer. However, until now, we still not able to get a formal agree on the how we can benefit, common benefit, and how can those developed country beneficial bring the responsible and share benefit and strengthen local or regional product. So that's still the big question. So in short, the high income country are used both impose obligation to the developing country or the global south to have their own responsible. So there is not agree yet on how can the country, the poor country or the low income country to get access to that intellectual rights of the medical care. And this is still continue, and we hope our advocacy is not just about how we take those advocacy for beneficial just only for the country or the government, of course, itself, but the people, vulnerable people who cannot get access to those public health coverage or universal health coverage. They don't even have the identity because they're so poor, they don't have their identity. So they don't even can get access to the very social health protection or social coverage, health coverage, or they even don't know what is this policy about, and they lose their life without knowing that they has those kind of right to get access. And this is very painful story. And when you talk to the government in each country, the government might tend to say, hey, this is the small marginalized group, you know, they based on the big figure that we do this, we do that. But in reality, the problem is not addressed because there is no identity or data figure out all those vulnerable and marginalized group who cannot speak the language or do not have the identity were provided by the local government to access to this universal health coverage. So this is the continued debate and advocacy from the regional, and I think this is an opportunity that we share. We discuss how to move forward and push those kind of high income country and benefit a lot from this expensive medical share back to the developing country. So thank you.
Thank you so much. I think COVID-19 is something that I realized that does not respect the rich or the poor. Yeah, but so many were highly impacted, and these are the poor. The vaccine inequality, the access to healthcare, then the poverty, domestic violence all came with the pandemic, and we are still battling with it all across the world, especially in the least developed and developing countries. So we'll turn to our next speaker, Harry. Harry Bignell is a health policy advisor at Oxfam. She has worked on global health access, pandemic preparedness and response, and One Health for the last 5 years. Since the start of the pandemic, Harris has focused on equitable access to COVID-19 vaccines, tests and treatments, and worked in coalition to highlight the dangers of pharmaceutical company monopolies and health nationalism. More recently, her focus has been the dangers of health privatization and commercialization. Harry, you have the floor.
Thank you. Thanks for the introduction, Caroline, and thank you for the invitation to speak today. My name's Harry Bignell, as you've heard, and I'm speaking today on behalf of Oxfam and the People's Vaccine Alliance. So in my speech today, I want to focus on how the gross inequity in access to COVID vaccines, tests and treatments that we've heard about disproportionately impacted already marginalized groups, and highlight how global health architecture and trends created the perfect conditions for this inequity to manifest. Oxfam's recently published a report highlighting the impact of global health crises on countries across Latin America and examining how inadequate state responses can be traced back to persistent austerity measures and fragile public governance. Except for Cuba, healthcare spending in the region falls significantly below the levels reported in OECD member countries. In other words, fiscal policies do not prioritize public health, leading to chronic underfunding and consequently making it more challenging for vulnerable populations to access healthcare services. The COVID pandemic is a striking example of how a global health crisis can compound these contextual factors with devastating impacts for communities. When the pandemic hit, Latin American nations found themselves beholden to wealthy countries who monopolized vaccine production and distribution and muscled their way to the front of supply queues, leaving other countries behind. In Brazil, cities with low human development index had the lowest vaccination rates nationwide. In Mexico, access to the vaccine was discriminatory based on employment status and particularly excluding agricultural workers. In Colombia, the migrant and displaced population, estimated at around 1.8 million, including around 4.7% of the population who are Venezuelan immigrants, could only access vaccines if they possessed a special card and a stay permit. In Guatemala, Honduras, and Peru, indigenous populations were among the last to receive COVID-19 vaccines. We also know that throughout the pandemic, gender-responsive interventions were adopted retroactively, with 91% of policies adopted by countries across all WHO regions and World Bank income groups being gender blind. That is to say, ignoring the impacts of gender norms, roles, and relations And this meant that the needs and the situations of women, girls, and gender diverse groups were often not considered until it became clear there was a gap in uptake. Women and gender diverse groups face complex barriers in accessing COVID-19 vaccines and treatments. In some contexts, women faced cultural barriers, needing to be accompanied by men to the clinic, and practical barriers, such as having little to no access to a vehicle or being time poor, having to take on the bulk of domestic work. The criminalization of gender identity and cultural norms in some countries meant that transgender and gender diverse people face significant safety barriers in accessing vaccines, and in some cases were discriminated against by healthcare workers. The impacts of COVID-19 compounded a global health system that was already not serving people on low incomes and those in vulnerable situations. Instead of progress towards universal health coverage, we're seeing a rollback of essential health services and a rise in out-of-pocket health costs. Half the world's population currently cannot access essential healthcare, with 60 people per second suffering catastrophic and impoverishing health costs. Rich countries continually push the idea that the private sector can help low and middle income countries develop their healthcare sectors. But in reality, what we actually saw was private hospitals, often invested in by wealthy countries and their development finance institutions, charging astronomical fees for care, denying treatment to those who can't afford it, even in emergencies like COVID-19, and pricing services and medicines wildly out of reach for most people in local communities. Big Pharma held fast to its stranglehold on vaccine supply throughout the pandemic and jealously guarded knowledge and recipes to prevent lower income countries producing their own vaccines and medical tools. And for all the talk of lessons learned, new pandemic prevention, preparedness, and response architecture lacks the concrete, enforceable, and far-reaching mechanisms needed to curtail the disproportionate power of Big Pharma and dismantle its monopoly over life-saving global health tools, which so often are publicly funded. I want to finish on a few recommendations for us to consider. Firstly, rich countries need to stop peddling the myth that the private sector and powerful pharmaceutical companies are the answer to health inequality. We have seen time and again that big pharma and profit-hungry hospitals cannot be relied upon to provide services and medicines that are quality, affordable, and accessible to people on the lowest incomes and those facing additional barriers to access. We need strong public health systems that incorporate a central role for governments as both funders and providers of healthcare, focus on comprehensive primary healthcare, training and recruiting sufficient health workers, as well as removing user fees. And finally, conditions must be placed on pharmaceutical companies to ensure that they cannot continue to profiteer at the expense of people's lives by charging extortionate sums for vaccines and holding crucial global health technologies hostage. Thank you very much.
Thank you so much. So before we give the floor, let me just say that leave no one behind means having an equitable social protection floors that is all-inclusive and accessible. As the world leaders gather across the streets from tomorrow, how can we get them to hear the voices of the most marginalized people, especially those that do not have access to healthcare services, including vaccines? The UN high-level meeting on preparedness and also high-level meeting on universal health coverage is a few days away from now. What is in the agenda for us, the people? So that should form the basis of our discussion. Let us see what they have for us. If it's not from us, it's not for us. Thank you. So I would like to open the floor for question and answers, and then recommendations if you have any. Okay.
You just brought up the summit that's coming on universal health. Does anyone know? Does anyone here in the room know what is in the proposed agenda? And if we don't know it, how do we find out? There must be ways that people can tell us in advance so we know whether to support what's in what they have or to demand that it be part of it.
I'm going to be translating. So for Mrs. Georgina. ¿Quieres hablar en español y yo luego-
Sí, gracias. Voy a hablar en español. Realmente este tema de protección social se ha venido discutiendo por GCAP, Latinoamérica y el Caribe.
Thank you. Protection has been being discussed in Latin America and the Caribbean.
Y sabemos que es urgente tener para adultos mayores, para jubilados.
And we know that it's necessary to have subsidized funding for women and different people in the society.
Sin embargo, tenemos que preguntarnos si hay voluntad política de los tomadores de decisión en cuanto a los recursos económicos y políticos.
But nonetheless, we need to ask ourselves if there is political will from the decision to actually carry this out.
Y en eso también el secretario general de Naciones Unidas ha sido enfático. No podemos seguir en la lógica de que las empresas transnacionales y los más ricos no paguen sus impuestos. Tienen que pagar impuestos para que haya los recursos financieros necesarios para la protección social.
And this also has been emphasized by the president of the Global Assembly that people and the countries in the rich countries, they also have to be paying taxes to also support this.
Y sabemos la responsabilidad que tienen los países del norte con los países del sur.
And we know there is a responsibility of the countries in the north with those of the countries of global south.
La pandemia evidenció la fragilidad de los sistemas de salud a nivel global.
So the pandemic has really shown the fragility of the health systems on a global level.
Y este es un problema estructural para Latinoamérica y el Caribe. Si realmente no se definen políticas de 2030 para invertirse también en los sistemas de salud, va a ser muy difícil que tengamos acceso las personas que están más marginadas.
So if political measures are not taken into account to really show how these structural changes have to be made, then there's not going to be a way of moving forward.
Por eso es necesario una nueva arquitectura financiera que realmente avance, que desaparezca la desigualdad y la pobreza.
So we really need a new financial structure and architecture to really address all these issues in poverty and social security.
Entonces, la protección social en Latinoamérica también la vemos como la renta básica necesaria para las personas que no tienen trabajo.
So in Latin America, we also see social protection as giving people the basic needs for them to be able to sustain themselves.
Y los gobiernos tienen responsabilidad, pero también los organismos multilaterales como el Banco Mundial, el FMI, el BID, de asumir estas responsabilidades para financiar los recursos.
So governments have this responsibility, but also other transnational and international organizations also have this responsibility to finance. Thank you.
Yeah. Yeah, I want to make 2 comments. First comment is about what she told about universal health care. So coming Thursday, September 21st, there will be USC, Universal Healthcare UN high-level meeting. So we are waiting for the political declaration from the people across the street. The other comment is about what Shin and Harry already explained about intellectual property rights. So when we are watching the movie, did you notice that there's a kind of Japanese narration? Yeah, because that part was extract of the movie we made. So that title of the movie was Pandemic Unmasked and Civil Society's Pursuit for Health Equity. So I'd like to explain a little bit about why intellectual property right matters. Because pharmaceutical company or drug company or big pharmas, they have patent for medical countermeasures. So they have elaborated very innovative vaccines. And actually, there are so many countries like China, India, Cuba, Argentina, who can produce same quality of vaccine if big pharmas or pharmaceutical countries allow them to use their technology. But there is a problem of colonialism. They don't want low and middle income countries to use this information. Now, we all know that nobody is safe until everybody is safe. So those rich countries apparently say that, yes, you can use only this and this patent, but only this and this. So it's not fair. So big farmers can fix the price, can decide to whom we want to sell. It means that low and middle income countries who cannot pay higher prices, they don't get it. Only rich countries like UK, USA, EU, Japan, they can pay very expensive prices. So this is kind of colonialism. For example, Japan this year, we hosted G7. Just before G7, a bunch of executives from big pharmas, from drug companies, met Prime Minister Kishida and asked him not to allow TRIPS waiver. So TRIPS waiver means, now you know, India and South Africa in 2020, they presented a proposal to WTO to stop the effect of intellectual property right related to medical countermeasures for COVID-19 during COVID-19 pandemic. But they, no, not they, so rich countries didn't accept it. Sorry.
I just wanted to respond very quickly to the question about whether we know what's in the declaration or not. There has been a leaked copy, so I have seen a copy of the declaration, but we were being told last week that that there's a current sort of hold up and the signatories can't agree to certain provisions. So we're anticipating seeing a final copy sort of towards the end of this week. But I have seen a draft version, but I think that is through somebody who's got a really good contact and they managed to get a copy and then it's circulated, which kind of speaks to a really big issue in how this information is disseminated, who gets to see it, who gets to comment on it. And the declaration in its current form has some very good elements and it's got some really negative elements that we would want to call out as well. There's a sort of a focus on including the private sector and not enough focus on sort of curtailing the power of pharmaceutical companies that you were just speaking to. So there is a copy in circulation that we can kind of share around. But like I say, I think there's a real issue that it has to be about who you know, whether you can get access to these documents or not.
Just to say, I had a look on the website and there is a draft political declaration, but it might be an old one, on the UN website, and I've circulated it to the GPA list. You've all got it, and I've sent it to Kathy, and I'll send it to you, but it might not be the current one. And as we know, political declarations are hotly contested. So I think the request made would be really, which you had, where it came up, can we agree on something to put into the hands of member states which is relevant to the Health Assembly? I think that would be really, really good. Thank you. As an action.
Yeah, thank you. So we'll pass the mic to you, then Africa, and then Europe to give their People's Assembly remarks.
Thank you very much. My name is Pradeep. I'm from Nepal and I represent Dalit Lives Matter. So I'll make it 2 points. One is on social protection. Who needs the social protection? It's very important issues. During the COVID pandemic, so we did a telephonic survey among 1,500 Dalit, if you know the Dalit, so so-called untouchable community in South Asia, still inhumane practice exist. So first person died because of starvation as Dalit person. His name is Malar Sada. So he couldn't get the food for 4 days and he died because of starvation. So who needs social protection? So that's one of the important questions. Second, I just we had a telephonic survey we did during the COVID pandemic time. So we asked 1,500 people, how many days do you have a food storage? So they have only 3 days max food storage. So even though there is a pandemic, even though there is a high rise of pandemic, they couldn't stay in home because they need to go out for the food. So first is food. So they don't have a food storage. So those who have a food storage, even in the lockdown time, so lockdown is very strict government lockdown, but they need to go outside for the food. So, and they got contaminated from COVID pandemic. So that's one of the important issues. Third one, I just want to raise. So when government released some food package for the poor and marginalized people, and some of these marginalized and poor people doesn't have citizenship. They live outside of their hometown. They don't have a citizenship, and they couldn't get these packages. So there's a multiple discrimination. When we talk about the social protection, these marginalized group need to address. I just want to mention one more things, and then I'll stop. So when we talk about the vaccine, so who got the first vaccines? First, the health worker, that's necessary. Second, those power holder groups, those who have a power and access. When there is a normal situation, and then he talks about the who gave the who produced this vaccine. Obviously, there's big economic countries like US, UK, Japan, and all in India also. And then, yeah, I will finish. So this vaccine also, these poor and marginalized people who need to go out every day during the pandemic for work, for food. So we did a survey, still only 68% marginalized people got the vaccine. So when there is a need for a vaccine, these people couldn't get the vaccine. So now they can get it. So when we talk about the vaccines, there's some people addressed about the Vaccine Alliance. So we need to think ahead about this. So how can we reach to marginalized and poor people in this process? That's why that's how we can ensure the social protection. Thank you.
Thank you. It's not easy for us, me and my sister, to explain what we want to talk, because I'm Francophone and she's Spanish. Yeah, it's discrimination, but we go to adapt. We are civil society. I think it's better to think for the others. It's very important for us. Because talking now for inequality, we're talking for justice, it's important to take that in the language. Me, I'm going to talk in French. Alors, c'est important en réalité de prendre ces préoccupations-là en charge. Yeah. No, okay, I go to continues for my bad English anyway. And understand to me. Yeah, no,
SO is behind the chat.
but she needs materials to do that good. Let me do you continues for my bad English. Yes. It's very important to understand, and I agree with you, COVID has accentuated the inequality in Africa. Because you know the African country cannot get a pharmaceutical firm. In this way, we understand it's important to have the process, a good process in Africa. They have launching 6 countries who go to hosted the MRM transfer, technology transfer. But this transfer meet many problems for acceptation for the license, and also the funding who can I don't understand what I'm saying. Who can move forward this process? And you know, it's not easy. And we ask now civil society what we can do. As we stop only for talking, as we stop to sharing declaration, what is the result of our action? Are our declaration, of our talking, if they have impact if the work? I think no. We must evaluate our strategies and see what we want to do exactly to move forward, because anything don't change since 50 years. Thank you.
So pass it to Neil.
Yeah, thank you very much. I actually was asked to share a couple of words about our regional assembly, so I probably will not focus exactly on this specific topic, but we of course also included it in our regional declaration. Just to share that this year we decided to do regional people's assembly in EC region, which covers 56 countries, and it's also like Canada, US. It's really weird region, whole Europe, Israel, and Central Asia and Caucasus. So, and of course we still, even of course it's completely different level for many countries than, I don't know, in Africa or Asia, the issues with the social inclusion and everything what was discussed today with the vaccine, but we still of course have issues also within our region, and especially with the current crisis with the war in Ukraine and so on and so forth. I'd like to inform you that here I have some flyers. It's not many, but there is a QR code that you can use to look at our regional declaration, and we already shared it with UNECE office in Geneva, and strongly asked to share it with member states, because I personally believe that if we want to make change, we first of all need to approach member states. And I think with this declaration, which I hope will come out also out of this global assembly, this is exactly what we should do. We should approach, like each of us, our country, because we should not rely like, oh, General Secretary General will do it for us or something like this. To the national, to your government directly. Thank you very much.
Good afternoon, everyone. My name is Becky Malay. I come from the Philippines, and I just want to share the GCAP Asia Regional Assembly demands that relate to social protection. So we had our regional assembly in September 5, and we are a network actually that are presenting. There's 21 CSO networks, and then some MPs actually attended our assembly, online. But we focused on 4 areas because the very important thought that we should put on the right to health and universal health coverage, and then food hunger, poverty, and inequality, meaning universal social protection. That is the main call. And then, of course, democracy and civic space and human rights are very important, because this actually gives us the context in which social protection floors are actually being demanded from governments that are not responsive. And of course, the Asia Pacific being very vulnerable to climate change impacts, we focused on social justice and disaster risk reduction. So in terms of the universal health coverage, it's the same demands that you have iterated, so we want to reiterate them. But we also want to say that we have to ask our governments to have adequate budgetary allocation to the universal health care coverage, because sometimes they pass legislations and measures, and then they say, yeah, we will give you universal health coverage, but there's no budget for it. So we have to push for that. So we also demand that the sharing of pharma science and technology through the WTO waiver on the TRIPS should happen very soon, because a lot of Asian countries actually are capable of doing vaccines and manufacturing vaccines on their own. Also, we have a demand relating to the amendment of the international health regulations, and it should enhance global health security. So we're not just talking about Asia, but mainly our interconnection with the rest of the world. But another area of social protection that we have demanded in our Asia Pacific, not Pacific, we don't have a Pacific region assembly, relates to food hunger, poverty, and inequality. And where we want to say that we should have a universal social protection floors in all of the countries in Asia, especially those countries that are massively affected by climate change impacts, and also wars, for example, Myanmar, which is not in a very good condition right now. We also are demanding to broaden the definition of food to include nutrition and access to food. And we're proposing community control over the natural resources, and like land, water, and all the resources that bring food. So I'll stop at that. Thank you.
Yeah, they want.
Okay. Before you read the questions, we'll give you 1 minute. So we'll take questions from Zoom.
Okay. My name is Mauro Pereira, de Janeiro, in Brazil. I would like to make one question. How can we have justice without combating environment racism? And is I work in the favelas here, and people water not have education, but more are poor. Global warming impact, just climate justice is the impact of global warming in the favela and the community in Brazil and Southern America, and it's similar in the Latin America. It's a little question.
Anyone want to respond? Yeah, I think, okay. You want to respond? Yeah, thank you.
Hello, everyone. My name is Dame Muni Ibrownie. I'm the philanthropist queen of Behavioral Health and the most active global peace leader in the world. And I'm here today. So I'm doing a lot of work. I'm only 105 pounds, not a politician. So you know you can do a lot. Everybody is asking questions, but nothing will happen unless you give me your leader, your country leader. You have to give me the right contact of the state bank of your country. And you have to give me a project that's already approved from the government. Talk to me because I already have done China and we also have done India. I'm behind many, many precedents. I bring them to a conscious level and I'm very good with business. I'm good in creating jobs, tourism, and healing. And I know right now, recently I did the peace between Indonesia and Israel. And I also did Saudi Arabia and Israel. And I did Egypt and India. I finished the train project in India. I have a lot of stuff on India because India is so big. And I'm sent to this planet with the key of Africa. So I have everything Africa requires to build. I have numerous technologies. These inventors are on my table. Why? Because the universe is providing me to make a change. And I don't want anything from Africa. So if you guys give me the right contact, not those crazy, dishonest people, I have so much experience that everybody is running out. And I'm telling you, look, you will make money with me. Why are you asking me? I want you to think about serving your people. I'll serve you. So I'm here. So he's asking me, I have medical, we have done 400 hospitals. Okay, this is nothing to do with UN. This is only Dame Muni Ibrownie. So if I can do it and you can do it too, I have behind many, many world leaders and I have inventory of funders. So perhaps I can serve you. I don't promise people because my work is very divine. Whoever I'm going to serve, I will serve. But you can that's serve for me. I double a lot. Okay. And my heart to your heart, love and peace. And we are one. Thank you.
Okay. Hi, thank you so much for your presentation. I'm asking about the social protection for, in this case, people who have been injured by the vaccine, which there have been many claims, testimonies to legal bodies about how they were not properly developed and tested. And for example, in Europe, AstraZeneca was pulled out of England early because it was so dangerous. And then what the West did was they dumped those vaccines on the third world, one of them being Syria, as being so vulnerable. So I'm wondering about if there's any kind of social protection in that direction against, the governments and against the companies themselves. So, and especially as we're on the edge of another round of some kind of illness, supposedly COVID's coming back.
Thank you very much. I just want to give a quick response. on the floor, which is about provision of a service. But of course, any service needs to be accompanied by regulation and monitoring. So it's not enough just to provide finance. We have to provide a structural, if you like, monitoring process that things are working well. I'm not an expert on the vaccine. I have been vaccinated 3 times. So I'm aware that we'll have ill effects. And what's important is to be clear what it is, where it happens, and get information in the right place. Probably the World Health Organization, I would think. But the social protection floor does not provide for redress. What it provides for is income and access to health across the life course. So perhaps my colleagues here will be able to answer more about the, about how to complain. And I just want to say with our offer here, if it is possible with your good efforts to convince the governments to put in place a social protection fund, as they should do, to make sure we have access to social protection everywhere instead of just the lucky few, it would be a tremendous help. It's not the whole thing, but it would be a great help. Thank you.
Yeah, I can respond very quickly. Just to, in general, I've got about a minute to wrap up. So just to say, I don't think we should be in any doubt that vaccines and medicines are life-saving. What we saw across the pandemic was an accelerated development process where we had companies that were able and had the financing and had the backing from wealthy countries to be able to develop vaccines at speed. I won't speak specifically to the AstraZeneca case because I think we could get pulled into a very long discussion about that. But what we are seeing, obviously, is wealthy countries investing public funds. So let's be in no doubt, these are public funds going into the development of vaccines, often with countries utilized in the process of developing the vaccines. There were a lot of the vaccine, and then when the vaccine was actually manifested, South African populations were denied access in lieu of wealthy nations, which pushed their way to the front of the queue. So I think there's a number of elements to this. Proper funding for research and development. We know that of the 15 pathogens most likely to cause the next pandemic, 10 of them currently have empty pipelines. It's not enough to wait for the next pandemic to hit. We need to be investing in research and development for these vaccines now, and we need to ensure that global health architecture and new pandemic prevention, preparedness and response infrastructure has the conditions, has the strong conditions that allow for access for everyone everywhere. We can't let pharmaceutical companies be the dictator of who does and who doesn't get access to vaccines. So we need these strong R&D pipelines. We need strong provisions for people to be able to access the vaccines wherever they are around the world. And we need to ensure that universal health coverage is back at the center of this declaration that we're going to see coming out next week. And I think there's real energy in the room for that.
Thank you.
Just a very short about our discussion. I think we kind of represent the vulnerable group or demand side or the why cannot be heard. So I think my point to conclude what the action should be is we cannot stop talking, we cannot stop discussing, we even cannot stop demanding. So that's what we're here for, and in the future for more demanding, just mainly to do more on behalf of the people, because they cannot be there without caring the people, the marginalized group. So I think for me, it's like the progress. So even somehow the progress cannot be made, but at least there is a space for us to talk at least there is a space for us to discuss, but we are not reaching the level that the action should be taken. This is what we still continue and cannot stop demanding. Thank you.
Thank you so much. Do we still have anyone on the floor? Leave no one behind.
Yeah, thank you so much, and thanks for the beautiful conversation. My only concern is that we're going to have the declaration, then what? You know, we just have the small delegation from our different countries, but do we get this information back to the country? In Kenya on the 20th, we are having this big global, we call it the SDGs Festival, with more than 40 organizations, and we'll be having more than 500 attendants. Yes, we are going to talk about everything that we are talking about here, but how do we bring our politicians on board? That is what I want us to think about. Thank you.
Thank you. So it's been a worthwhile, and some of the key things that came from these discussions, especially the intellectual property right, is something that we all need to work around. Issues of discrimination, human rights, vaccine inequality, security, things that we should begin to think, actions that are beyond declaration into my African brother. Then what do we do really now that we are here in New York? Because it trickles down from here to the communities where they sent us from, or where we are representing the people we claim to represent. The advocacy for collaboration forms part of our proposal for this session. So in the coming days, things that we should do, one is to get behind the universal health coverage process. And then let's see how we can impute into the document. Let's show more concern that we are concerned. We want to see the content, what you want to give to us. Then you have to work with the government. I know some government representatives, the delegates are very unwilling, but we will not for them and then be able to give them what we can give to them. Then also, we are calling on everyone to join the Coalition for Social Protection Flows and support the Global Fund for Social Protection. Then we need to think together, then act together. Thank you for coming. Have a good day.